Hi, Dr. Tom here. This is Garija, and we are in a treatment cycle to raise foundational nutrition and to raise baseline immunity. And with the current COVID epidemic, it is very, very important to raise your baseline immunity. So I'm going to show you something that you can do at home to raise your baseline immunity. This is home vaccination for COVID. So let me show you, I'll go into the details on that later, but let me show you basically how you do it. Garija is part of a stratification of people that we call vulnerable individuals. So we want to raise her baseline immunity, and we're going to do that with traditional Chinese medicine cupping today. So Garija, if you could turn, I'm going to show you some certain lung points on the back. So if you look at the back, the surface of the back, and you go up here to the top of the neck, you'll feel that the ridge bones of the midline of the spine, they make a big lump right about here. And so I'm going to mark this right here. That's the lump right there. Now underneath that, I want you to go 1, 2, 3, 3 lumps of the spine right here. And then you go out, and we're going to be cupping from here to the armpit area here on both sides, and this armpit area over here on both sides. So we're going to be cupping this whole area, decongesting this, and this is going to improve the immunity of her lungs. So cupping is very, very easy. The supplies that you need is a cup. You can use a teacup, you can use a shot glass, but anything that is a cup that has a little bit of a soft or rolled edge on it, you need some sort of alcohol, and you need something to hold alcohol with. You can use cotton balls dipped in alcohol. There is a big run on isopropyl or rubbing alcohol right now. You could literally use 100% grain alcohol or whiskey, and put that into onto a cotton ball. I just take these alcohol prep pads, fold them twice, hold them with tweezers or a hemostat, and then it's lit with a lighter. Now that's a flame, it looks hot, but actually it burns at a very low temperature, so it's not dangerous. It would be nice not to have the alcohol drip onto the skin, because the burning drip of alcohol in the skin would startle the patient even though it burns at a very low temperature, you see? So I'm going to get a fresh alcohol pad here. I like to use 2 at a time. Fold them twice. Hold it with the tweezers. And then, based on the principle that heat expands, and we put this into there and then just put that on. And if you look down here carefully, you'll see that as the hot air inside begins to cool, it draws the skin up into there. And then if we remove this, we may see some redness of the skin, and if the skin is extremely congested, it will leave what looks like a bruise mark. Garija has just finished a 7-day blood cleansing liver detox, so there's not a lot of congestion in those tissues. I'm going to move from this central area here, and we're going to be cupping in this region, because this is the region that will improve her lung immunity, improve her baseline immunity. So here we go. This goes pretty fast as long as the alcohol lasts. So that's why I have other prep pads to change to. This therapy has been around for thousands of years. It survived the test of time. A lot of air in there. When the globe starts to become suffocated, you can just relight it and keep doing it again. There's no discomfort to the patient. A lot of patients will fall asleep while this is going on, start snoring. It's usually very relaxing. If there's a lot of congestion in that tissue, then the circular marks underneath the cups will be quite dense and quite red, look like a bruise, but it's in no way painful. These can be left on for quite some time and the skin will become more and more red and congested underneath, but let's just take it off right now. She's fairly clean in her tissues, and you can see this redness right there. How dark the redness is actually shows how congested the tissues are, and drawing that blood from the bloodstream into the space of the skin around the blood vessel is by definition a vaccination event. What's it vaccinating you to? It's vaccinating you to whatever is already in your blood. And in this period of time, we're starting to believe that almost all of us are exposed to microbes and potentially COVID. And by doing this repetitively every few days or once a week, according to how dense the bruising phenomenon appears here, the bruising phenomenon will become less and less and less each time, and that by definition is an improvement in your baseline immunity. So think of it as immune vaccine boosters. Repetitive boosters improve the baseline immunity. So as you improve the immunity in this area, you're improving the immunity of the lungs underneath the chest wall, and you're strengthening your resistance to viruses and other microbes like COVID. Thanks a lot. Stay tuned. Share this with other people you love and care about. You can also open up a new tab and just type in drtom.com/stayinformed.